That's good.
Okay, I think, are we all centered?
Yeah, we're good. Okay. Hi, everybody.
Hey,
It's Christine and Tina, ladies of the Lanai. I'm Christine.
I'm Tina.
And we're out on Rebecca's lanai today.
Yeah.
Yeah, she has a bigger lanai than I do. And today we're going to talk. We've had Rebecca on before. She's a professional in the health insurance space and been practicing for many years health insurance in the villages, in particular for how long?
3.5.
3.5 years. And our main topic today is going to be what's going on with the bankruptcy filing for the village's health. And we're also going to be talking later on about changes that we will, every year there's changes in health insurance. We know this. It's nothing new, but there are big changes, according to Rebecca, for 2026. But stay till the end to hear about that. And before we get started, we also want to just remind everybody that if you enjoy the content that Tina and I bring to you every week, please make sure to like and subscribe. And share for sure this information with anybody, especially if you're coming into the villages about health insurance, because you're going to have to make some changes.
Yeah.
Yep.
So how about these Florida vibes?
I know. You know, sometimes
We're hanging on to summer.
we are. I mean, it's fall, but it's still going to be upper 80s here. In case you're somewhere else wondering what it's like, it's still warm out. It's still beautiful if you like warm weather, right?
And I'm going to a pool party later.
The humidity is down. Have you
Yes.
noticed?
Oh, right
My hair will
now.
tell you.
Oh,
Yeah. So the first thing we want to talk about is this big announcement that those of us, I'm a member of the Village's Health. Rebecca is a member of the Village's Health. Tina, maybe year down the line, she will be as well. But we got a notification, and it's been moving forward, that the Village's Health will be filing for bankruptcy. And that is moving forward, and that there is also a purchase of that entity, if you will.
And it was approved by a Orlando bankruptcy judge just this week.
So
the
why,
bankruptcy
in the first place, is this happening? Can you tell us?
In simple terms.
Yeah.
well, they had some billing errors and they self-reported, and what they reported and the fines and everything, it's over $350 million that they would have to pay back to the government. And I'm not saying that they're still not going to have to pay it back, but the reason that the judge had kind of put a hold on the bankruptcy is he didn't like the language in the bankruptcy paperwork that nobody could be held responsible for that money. So I'm not sure if they changed the language in the bankruptcy that allowed the judge to approve it, and now it's moving forward with Centerwell purchasing the Village's Health. I'm not sure how that money's going to get paid back, but it does say in the paperwork that Centerwell will assume all responsibility for that. So I'm assuming that all those fees and fines will be paid back to our government.
But we still don't know if anyone's going to be held, if any individual is going to be held responsible in any kind of.
In general, when things like this happen, is it you know what I mean? Like, do they point the finger at a department, a person? It's just the company, it happened, and this is what we're going to do?
I mean, this is pretty common. Billing errors are pretty common. A lot of times when it happens, it could have been doctors that were frauding the system and then they get their license taken away. You know what I mean? It's usually not somebody as big and reputable as the Village's Health. So it is pretty common that this happens.
Unfortunately.
But it didn't, the thing is it didn't take anything out of any of the patients' pockets, okay? They were misbilling the insurance company. So like if you have an Aetna, if you had a Humana, if you had United or Florida Blue, those were the people that were overpaying.
So patients at Village's Healthcare, no one's going to come to them and say, because they misbilled, you owe extra money, or, for your treatment or visit.
Because everything has the code.
The code,
right?
Yeah,
So
I was just going to ask that.
It's
they inappropriately
coded.
Used the wrong codes.
Correct.
For treatments or services.
Correct.
And they got paid back too much money.
A larger amount than they were entitled to.
For the services that they provided.
Correct. And so the insurance company is the ones that are due that money back.
Yeah.
Because
Oh.
Villages Health does not take original Medicare and Medicare supplements. So it wasn't, the federal government, for everybody who's on a Medicare Advantage, pays the insurance company an allotment amount, a monthly amount for each person. And if they have critical care or certain, chronic diseases, they pay them more each month. So they're constantly looking for conditions that they can add on for coding to upbill the insurance company. So it's pretty common.
Yeah. Okay. So, what do we have any idea what this might mean for the people who work for the Villages Health, first of all, and then for those of us who are the patients?
So, I mean, I really haven't seen any change in the model of care or the level of care. Everything they have said is it's business as usual. They're still moving forward. The bankruptcy was approved. Centerwell plans on closing by the end of October 31st at the latest, and nothing will change. Your doctor will not change. Your health insurance company will not change unless you change it during the open enrollment. You do not have to have a Humana plan to use Villages Health.
And Humana is the parent company of Centerwell?
Yes.
Okay.
Mm-hmm.
Yeah, and they use this language that the Centerwell is payer agnostic.
So Centerwell, on their own, they have two primary care locations of their own, one in Spanish Springs and one in Leesburg. And they take all types of insurance, original Medicare, supplements, and other Medicare Advantages that Villages Health does not take. So they have a pretty open book to almost every plan that's available.
But earlier you said 2026, that's not going to change. So in other words, we're not expecting that the Villages Health will take original Medicare in 2026.
Correct.
Or anything will change.
No.
But perhaps 2027.
Right.
Perhaps.
Maybe. So
Right.
we're going to see if they're going to stay with the model of care for the Villages Health and just continue with their own clinics in that manner, or if they're going to, open it all up. That hasn't been disclosed yet, but it won't happen, to my understanding, for 2026. Everything will stay status quo.
And level of services, Tina, you do know about something that's been paused.
The dementia care program that our previous guest, Wendy, had talked about for her father, that apparently is on pause right now. So, at least, that wasn't a treatment per se.
No, it was like a free service, more
For families.
informational training for families who had a dementia patient in their family, and they found it to be very valuable. It was a free service, but that's been on pause.
I'm sure while they're restructuring and doing all of this. But the other thing is, since both of you are participants in Villages Health, it's not like you've seen a mass exodus of your healthcare providers or the doctor, everybody leaving, or
No.
you shouldn't be afraid of that.
In an article, there was one doctor who was upset, but that was nothing to do with the bankruptcy. It was due to
His work schedule?
his
or
work
something?
schedule, yeah, his patient load, what was told to him and what actually happened. And
That happens everywhere, though.
Yeah.
exactly.
You know?
So, how they hire you for one job and then they want you to do three.
5.
Yeah, my doctor's still there, and her physician's assistant is still there, and I like them both. And I didn't notice anything different.
So to your knowledge right now, as someone who participates, as villagers who participate in the program, what can they expect or not expect to happen going forward at this time from what we know?
I just think, everybody needs to take a chill pill, take a step back.
Wait and see.
Take a deep breath.
And unless you read about this in the paper, you wouldn't know anything was changed or different. And that's the way they plan on keeping it. So I don't see doctors leaving. I don't see nurses or staff leaving. There's no reason. They're still going to get paid. They're probably happy about Centerwell taking over.
And you had meant when we were talking before we started recording, you had mentioned that Centerwell had been looking at Villages Health for a while.
Right. Yeah.
Yeah.
Prior to this whole announcement.
So it wasn't like they're picking up
They just stepped in out of nowhere.
Yeah, right.
Yeah, because last year there was a little commotion with some things, and we had heard that Centerwell was going to try to buy them. So I think they've been trying to buy them for a few years.
Before this all happened.
Before this all happened,
So,
yes. And I
that's a
think
good
this,
sign,
this just made
I
it
think.
possible.
Well, they must think it's viable, even if they have to pay part of whatever's owed, that they would still step in and purchase it. I mean, I don't know the technicalities of anything, but
yeah, it seems like it.
Well, I think they have, around 55,000 patients. So for them to walk in and have 55,000 patients
it's a good deal.
yeah. So,
Okay.
so so I'm not worried about that part. I know that everybody else is, and it can sound scary, but
Sure.
and if you don't want to use the Village's Health, by all means, that's your choice, and you can use outside doctors. They're in the Villages, they're just not part of the Village's health system, but you still can use other doctors. So that is
So if
totally
I'm a
up to you.
participant and I am scared, what would I do going forward, like tomorrow?
I wouldn't do anything. If you're happy with your doctor and your care, I would just stay with
But
it.
if I was nervous and I'm like, oh, I don't want to use Village's Health.
If you wanted it, let's say you already decided, I'm out, I want
Yeah,
to make a
because I'm
change,
nervous.
then you have to,
We start looking for new doctors.
yeah.
Okay.
And we, meaning if they were working with someone like you, who's
Mm-hmm.
an advisor, you can help people, whether they wanted to stick in the Villages or go outside.
Right.
You're good at helping people find their. So, what about all these other sort of sales that are going on Villages entities? Does it have anything to do with it, such as the PNC insurance, Villages insurance, and then the bank? Let's talk about the insurance. Does it have anything to do with the Villages insurance?
Mm-hmm.
Does it have anything to do with this at all?
Nothing at all. The Village's insurance was always owned by Baldwin Group. Baldwin Group went by many different names in different parts of the country. So, they're a big corporation, and they own agencies all across the United States.
Wow.
And they decided that, I think management shift around in Baldwin, and they just decided it was better for branding if they just made everything Baldwin.
So in other words, the Villages insurance was just a brand of the Baldwin all along.
Yes, it was. So it was never sold. It was always Baldwin Group. They
Just a rebrand.
Just a rebrand, name change. Yes.
Interesting. And what about the bank, the Citizens First Bank? That is a Villages entity.
Yes.
And that's being sold to.
Seacoast.
Seacoast.
Does that have anything to do with this?
I don't think that this has anything to do with that. I think that they maybe just want to get out of some of this kind of type of business and stick to, when you're good, developing, when you're good at something, and they are definitely good at developing.
They know what they're doing. Because the other thing with the sale of Villages Health is the real estate is not being sold. So the Villages still owns that commercial property.
And they still own
understand.
the property of Villages Health too. They're not selling the land or the buildings. They were always leased to the corporation already, and they're still going to be leased to Centerwell. So Villages Health will still own the property.
Okay. So that's what we know for Villages
Yeah, what
Health.
we know, and certainly there's a lot we don't know, but thanks for, clarifying some of these questions that I think people might have, because we did get a few questions about what we think about it. And then also, Rebecca, again, we said it earlier, you're in the health insurance space. You help people with Medicare and regular commercial insurance if they're not on Medicare yet.
Correct.
And so you're very knowledgeable in the space. So every year we know there's going to be changes in insurance. That's just how it's always been, especially health insurance. And what do we think, or what can you tell us about 2026?
What's in the pipeline? Should we be scared?
Yes, you should.
It always seems scary.
I'm scared.
Oh.
But it'll all work itself out. Sometimes we have a couple scary years, and then it reverses back. But for 2026, everything that's coming down the pipeline is the cost of insurance is going to go up for services. In other words, like maybe co-pays, and you may get less of a benefit. So they want to revert back to basic health care and stop with all of the incentives, causing people to jump plans and switch, or getting a plan strictly for the dental or for a food card or for vision or transportation,
My old company, I was going to say, I know right when I left, because I'm still on Cobra, but they dropped the dental. They had a dental program and they dropped it. I'm sure it was expensive, but
that's
probably
huge.
companies are doing a lot of that. So I just do my own dental thing.
Right. So on original Medicare, Medicare doesn't cover dental or vision, only diseases of the eye. So if you go on original Medicare, you don't have any dental or vision or hearing with it. And then you buy a supplement plan, and that supplement plan only mirrors what Medicare covers. So they don't cover dental, vision, or hearing either. So, and then you get a standalone drug plan. So on Medicare Advantage plans, the reason people go on them is usually there's zero cost, additional cost, and then they provide you some additional benefits like the dental, vision, hearing. Some have transportation, gym memberships, and food cards, over the counter, the OTC. So you get some different incentives to go on it, and I believe some of those benefits will be reduced for
I would say, I know
2026.
my insurance company, they keep sending me emails about weight loss. Like, we can send you a kit for weight loss, like a scale and a food scale and this, and I'm like, okay, what are they trying to tell me? But they keep sending, so I assume that's an type of incentive thing, or no?
So like if people can't participate at a gyms, a lot of the companies have like online workouts, and they have mind games, and they have like that little things they
Or
can
what
send
about
you
silver sneakers? That's also isn't that a free gym membership for?
yes, but Villages Health does not take silver sneakers, but our 3 plans at Villages Health, Genesis does take them. Humana, Florida Blue,
Because that
and
place is
United.
packed.
It is.
That's like a social center of
It is.
everybody hanging out for free gym membership.
Yes, but a lot of people are paying for it,
Yeah.
and it's not cheap.
Yeah.
No.
I mean, it's almost $100 a month
Yeah.
for their membership. So, yeah. So, I mean, it has some great incentives if you're healthy, and the other thing that we've seen that a lot of for 2026, it looks like they're going to try to phase out PPOs, and HMOs are going to become the choice, the only choice.
Oh, wow.
Of it, maybe. We don't know until October 1st. These are just speculations and things that we've heard until it's in writing and the plans actually come out and we can look at them October 1st. We won't know for sure. However, the villages is a bubble, and it's really protected more than any place else in the country I've ever seen. So the rest of Florida, it will be a hurricane.
Whoa.
Villages will hardly notice
Why is
anything
that?
different.
Yeah, why
that?
is that?
I have no idea.
In what way? Like, for example,
So because we already have like a huge intact system.
but what
that
kind of
is-
things would change that wouldn't change here, like outside of?
A lot of plans are exiting. They're leaving. The whole thing is they're apparently, if you cannot make a profit, why are you going to keep that plan? And if it's not profitable, so they're getting rid of the plans that are not profitable for them.
Do you think it's because the population here in our demographic is healthier? That the insurance companies might not be so quick to exit? Is that what you're saying? Or
I really
is it speculation?
I haven't been able to figure it out.
Okay.
Because I mean, to me, there's just as many sick people here as there is anywhere else. However, in rural America, those are supposed to be the sickest people in our
Well, they
country.
can't get to
Right.
there. It's too far away.
Yeah, and so they don't do their annual
Oh, boy.
checkups. And when you don't do your annual stuff, you
don't find
you don't
things.
catch things, right?
Yeah, blood
I know,
tests.
my mom, I told you, I shared with you before, but my mom was diagnosed with leukemia last year. And I grew up in a small town in Indiana, but it was like 30-some thousand. And they had a cancer specialist there, the oncologist, and he left. And it took like a month to 2 months for them to get another one to come. So she had no doctor there.
Right.
She had to go to Ohio to the specialist,
Wow.
but not for like a regular. So you're right, they're underserved, and therefore they can't catch things.
Because well, the other thing is, and this really makes sense in a rural area. If you look at a rural area, the housing and the lifestyle and what's there to do there, it's very hard to get a doctor to stay there longer than 6 months or a year because they're married and their wives don't want to live there.
Right.
There's
And they
nothing
want
to
good
do
schools for their children.
Yes.
And
Yeah.
So there's a lot of reasons why they can't keep doctors in rural areas.
it also seems within the villages, though, that people are also very proactive, like in their health care.
Well,
You talk to your friends.
Well,
Did you
because
get that?
with social
Did you-
interaction, you can share ideas and findings and experiences with others much more easier than if you were a more isolated environment. You'd be like, oh, I've got this spot. I'll just put cream on it. I've got nobody to talk to about it.
Right. And you
Yeah.
have a lot of people that you can confer with and,
Yeah.
you know, say, no, you need to go to the doctor
Yeah,
now
that happened
or
to my
whatever.
friend down the street, and this is what she did.
And you know, I've talked to a lot of people that they live somewhere, a neighborhood their whole life, and they said they didn't have friends like they have here now to do the things with. And so, you know, I'm sure different parts of the country are different, but the people here, for the most part, are very friendly, outgoing. They want to get together and be active and do things. I'm amazed 80-year-olds still playing pickleball,
Oh, yeah.
playing golf.
There's a man we want to probably talk to, but a friend of mine, another Tina, had told me he's like 91 or 92, and he's a pickleball player, and he's played at every pickleball court in the villages.
Does he dance? We should introduce him to Pat.
That's right.
Does he dance?
Good idea. I
Yeah,
don't know.
Let's do it.
Okay.
All right. If you know, you know.
We got another show coming.
Wouldn't that be? Oh, yeah.
Hmm.
Matchmaker.
Yeah, so my advice for 2026 is don't wait till December 7th, October 1st. If you have an agent, please contact them. If you need my help, you can contact me. We'll hopefully have all the information by October 1st. That is an
And what would
official
the
date.
conversation be? It's October 1st, the new plan, like, to talk to you or whoever, like, is there anything I need to do or what's changing for me or should I change plan? Those kind of questions or?
Yeah, well, every year, if you're already here and on a plan, you will get what they call the ANOC letter, the annual notice of change. And that comes and it will have the plan you're currently on and the plan change for next year. They'll be side by side, any changes. So for instance, if you're paying a $20 copay for specialist and it's going to stay 20, it'll stay 20. But if it's going to 30 or 40, you'll see 20 and 40 on one
It'll
side.
all be on one line item,
Yes.
so you can compare.
So you can compare what's changing on your plan. And then if you have questions, you can call your agent or call me, or if you want to know if there's a better plan for you.
Right, if someone needed someone to explain that letter to them, you could do
Correct.
that.
Yes, I can. So you actually get the ANOC letters. We don't get them as agents. Actually, the clients get them before we can ever even
When
see
do they
them.
come out?
They come out in September, so they should be coming any day now.
Ooh, okay, timely.
Yeah, I guess you haven't gotten yours yet.
No,
Because
no.
because we're like getting close to the middle of September, right? And then figure October 1st, everything, that's
And
when it
that's from your
starts.
insurance provider.
Yes.
The ANOC letter
Yes.
comes from your insurance provider.
Yes, so if I'm on United Healthcare or Freedom or Ultimate or whatever plan I'm on, I will get an ANOC letter saying if there's any changes to my plan, or you will also get a letter if your plan is exiting. It will say that your plan will be exiting at the end of the year. As of December 31st, you will no longer have a plan, so you will need to enroll in a new plan for January 1st.
Yeesh.
And you have from October 15th through December 7th to make that change.
A new plan, do you mean a new carrier, or do you mean the carrier is stopping a plan and you have to pick a new plan, or both?
Either or.
Either or, okay.
So that's your opportunity to look at other, say that your PPO is exiting and you say, oh, I really want to stay on a PPO. Then we might have to look at another company that might have a PPO, or there may not be any.
And you can help people determine if they do have to make a switch, can they keep their doctors? Because that's what people care about a lot is, can I keep my doctors?
Correct.
Someone like you can help them figure that out.
And the other big thing that's changing, every year this changes, is the formulary for the drugs. Okay, so this is very, very important. This is a loss leader for insurance companies. This is why a lot of changes happened last year. And they are taking a big bath. They've been subsidized for 2025. I don't know if they're going to continue to be subsidized for 2026.
Who subsidizes it? Is it the government?
The government is, because this all happened so fast that they knew that seniors wouldn't be able to handle the cost. So after each person meets for tiers 3, 4, and 5, if you have a drug meets their annual deductible, in 2025 it's $2,000. I believe it's going to $2,100 in 2026. Once you meet that deductible, all of your drugs are zero cost for the rest of the year. And the insurance company gets to pay 70% of the cost of those drugs. And so for people that are on the real expensive drugs, that's a lot of money.
Mhm.
And so they have been hit with this big costly burden.
Mhm.
And they have to reduce the benefits in order to pay for that somewhere.
And would it be appropriate for me to say at this time that if you are stuck with drugs and your insurance, that there's other options you can go to? Just check them out. GoodRx.
Well, GoodRx is not good for name brand drugs, but we do
Right.
have Canadian drugs.
Canadian drugs.
We also have the patient assistance program. You know, it depends on your asset and your income level as far as if the drug manufacturer will help you or if they have a trial running.
And
Some
you
of
can-
them
you can help
have
people work-
grants,
And
because
grants
my
and-
mom got
yes.
a grant for
You can
her
help people
chemo.
figure that out too if they have one of these exceptional drugs. Like my daughter was on Imurex for migraines. It was very expensive at the time, and we wound up getting it on Canada drugs. We just had to upload.
What does that
a
mean,
prescription.
Canada?
It's
They're made
just
in
they-
Canada?
Yes.
Oh.
Canada approves drugs before the United States. So like,
But I shouldn't be leery of it coming from Canada?
no, not at all. It's very safe.
Mhm.
I mean, it's just
I
like,
didn't even know that was.
And then Mark
a
Cuban
thing.
has a company.
right. Here's the thing though, if you buy your drugs from Canada, they don't go against your deductible or your, you know,
Okay,
your,
interesting.
so this is why a lot of that doesn't make sense because once
Okay.
you reach the 2000, you know, you're going to pay a percentage. And once you and you can even, they have a payment plan.
Interesting.
So once you reach the 2000, you're not going to pay for that drug anymore for the rest of the year. So,
Okay.
all
right.
So
You'd have to really calculate it out. Is it worth it?
yes,
Okay.
correct.
Good to know. Good to know.
Really?
So a lot of options, you know, people don't know what they don't know, and that's why they need a professional to help them, not a neighbor. Please don't let your healthcare professionals advise you. I'm not a doctor. I don't give medical advice. I'm not a plumber. I don't give plumbing advice. I do health insurance and life insurance and cancer plans and things like that, dental plans, and that's the only kind of advice I give unless it's unsolicited. And I do have my opinions.
You give good Lanai advice.
Yeah, yeah. You gave me good health insurance advice recently, so.
Yes, I do. I try to do what's right. I'm an independent agent, so I carry mostly all of the companies that are available. And then I find out what your drugs are, your doctors are, and what's going to suit you. And we make the recommendation off of your needs, not my needs. Okay.
So if anyone is interested in contacting Rebecca for any of that that she just mentioned, we're going to put her phone number and her contact information in the description of the video. Anything else, you guys? Wrap it
I think
up?
so.
All right.
I look forward to helping you.
All right. So once again, thanks for watching today, this installation of the Ladies of the Lanai. And again, if you like what the content that Tina and I bring to you, we really love that love back in the way of likes and subscribes and shares of our shows.
And we all love them.
All right.
They're
Bye for
great.
now.
Bye.
See you next time.
On the Lanai.
Yes.